Hey guys, Holly Warner here, coming at you, talking about peptide therapy. Okay, so what the fuck? Peptides? What do you mean peptides? What are those? What do they do? All right, I'm gonna do a couple of videos just because I feel like this is gonna be a long one. So if I split it up, you're gonna get more information. So I wiped out pretty friggin' hard yesterday. Like coming out of the steps of my house, and it's icy because I live in Canada and it's December. Wiped out so hard on two little steps on my back. So needless to say, my back went kind of all a bunch of different ways. I hit my knee, I hurt my wrist, my neck got a little whiplash, which I can do that today because I just did 2 rounds of peptide therapy. Yay! So I've been doing the injections. Luckily, I happen to have some handy. It's something that, we tend to keep in the fridge. It's just something that, is really good to have around. Use it for patients, but I'm using it mostly for myself right now because, being injured isn't really fun, especially when it's your birthday. So I grabbed some of my peptides and I reconstituted them with my back water. And I gave myself a little injection. I did about 350 micrograms. I'm gonna do that twice per day for 3 or 4 days, just while I'm in that repair phase, because that's what regenerative medicine is all about. The beauty of functional medicine and regenerative medicine is that we play with things like peptides. Now, the peptide that I'm currently using is BPC 157. It's easy to remember, just think bulletproof coffee, although that's not what it stands for. I had to shift around a little bit there. It was getting uncomfortable. So I might pause this video a few times. Anyhoozle. So the body protection compound, BPC 157, is one of my favorite peptides. I like it because I do a lot of work with patients who have gastric issues. So we're looking at Crohn's and colitis, IBS, IBD, ulcers, really good for people with ulcers. It's really reparative for the gut and the gut lining. It's got a lot of neuroprotective properties. I'm going to go into, I think, a little bit more detail on this one specific to the BPC 157 because that's what I'm using myself right now. It's fantastic. It actually comes from human gastric juices. So we produce this. Yeah, pretty cool, right? I like the fact that it's been triggered. And because I've been triggered into repair mode because I injured myself, it makes this particular peptide actually do its job much more effectively because it's like my body sends out a signal saying I'm injured, I need to repair. And I can inject this peptide in and around the area. It doesn't really matter. It's going to get to where it needs to go anyway, to a certain extent. So when I inject it, it's going to be like, oh, there's a signal over there, like the bat signal. And it's like, we need to go there, guys. And then off it goes and starts to repair all of my tissues. I think that that's a fantastic thing. If you're injured, that's kind of what you want your peptide to do. So seeing as most autoimmune conditions that I deal with tend to be something that starts sort of in the gut, leaky gut can be, the theory is, traced back to being what started the cascade for a lot of autoimmune conditions. Rheumatoid arthritis being one of them. Thyroid issues. Now, we talk about Hashimoto's with this, so that's kind of interesting to use the therapy for that. But thyroid in general. I mentioned ulcers and Crohn's and colitis. Any kind of gastric distress, really, this stuff is really good for. And you can do the oral form as well. I just happen to want to use the injection subcutaneously. I use a needle that's a super small gauge, like a diabetic would use for their insulin shots. Super tiny needle. You don't even feel it go in. Like, you literally don't feel anything. And if you're someone who has tattoos, then don't even come to me and say you hate needles. Like, that shit hurts. I know. I've got quite a few. It's great for accelerated healing, your tendon to bone damage, ligaments, muscle tissue, all of that. So accelerated healing, which is why I'm using it in this instance right now. It's got an analgesic kind of effect. So it's almost like it helps with the pain aspect. I'm not taking any Tylenol, I'm not taking any NSAIDs, no non-steroidal anti-inflammatories. I'm not taking anything for pain. I'm literally just doing some wob enzyme and I'm doing my CBD rub, which is fantastic. It's got some arnica gel in it. I love it. It's a really potent one. I went to a higher dosage, milligram wise, for this. And then my peptides twice a day, which is awesome. Yeah, what else? Muscle sprains and tears. So it's good, like, you know, for those of you that are my friends who are gym rats, skin burns, it helps on a neurological level. It's pretty cool for that. Oh gosh, what else am I missing here? It does a lot, and I want to try and keep this video to under, 5 minutes. A lot of people are using it for tendinitis. They find that it's really good for that. It does increase your cognitive function. I've noticed I'm much more alert, which is kind of cool. And I mean, I did my first injection last night, post-fall. And I noticed that today I'm already like, ooh, mental clarity. Like I had one coffee and I don't really need more than that. So that's kind of cool. Oral dosage is different than the injectable dosage. A lot of people say, for 2 or 3 days, like 3 days, take 300 micrograms once a day, twice a day. It really depends on if you're super injured or not. I'm doing 350 twice a day. So I'm basically doing 700 milligrams per day for like 3 days. It's a higher dose, but it was a pretty wicked injury. Like I was in a lot of pain and I'm functioning pretty well today. My head doesn't hurt, the headache's not there, my neck has mobility, which is insane to me because I was fully expecting to wake up today and be just a complete write-off. There's no real contraindications to using it. If you're someone who is going through cancer treatments or has cancer currently, then I don't really tend to recommend peptide therapy. Just because we don't really know study-wise. I know the Russians have done some studies and then went, oh yes, we studied it on rats, but we all know that they studied it on humans first, but that's not how studies work when you're putting things out there. So they're not able to go by those. So they kind of went backwards, did some shit on rats, and now they're doing shit on humans. So we got to wait for those results, but we all know that the results were a success. That being said, it's a cautionary tale. Just don't inject shit or take shit that could potentially cause any kind of growth. If you're putting something that's going to, have a propensity to encourage hormone growth or anything like that, or a tumor growth, you just want to be careful, for sure. Which is why you typically want to be under a licensed practitioner's supervision when you are dipping into peptides. And you also want to be careful the source. So when it comes to sourcing it, I'm pretty particular where I get it from. Most of the stuff that's out there, when you find it on the internet, which I won't touch, actually comes from China. And you can get people that are saying, there's websites all over the place, that are saying, it's a product, made in the USA. When they send the peptides over and it's bottled, there's a legality, it's a technical loophole. So they can say that it's made in the USA because it was the final step was bottling and it was bottled in the USA. So that doesn't mean that your product comes from the USA. There are other peptides out there that have been tested. When you order, 10 milligrams, you're getting 5. There are ones that have tested out there where you were originally getting something really good and then they changed the formulation. As with the supplemental world happens with, practically everything out there. You get a really good formulation, costs them lots of money. They decide to cut corners where they're bought out. And the next thing you know, that formulation changes, which is why R&D is a big part of what I do in my practice, because I'm familiar with how it works. And so I'm constantly on the ball and talking to colleagues who are also testing products. So we make sure that you're always getting the best information. It's very important. I don't recommend getting it from somebody. If you can get it from a compounding pharmacy, that's fantastic, which is where we get it from. Some compounding pharmacies, they'll test them. They're very expensive to make, so peptides are not cheap. If you're getting cheap peptides, you're probably not getting peptides at all, or you're getting something that could be carrying a bacteria. You really have to be careful. You don't want to be ending up getting, an infection or sepsis or something that could be potentially deadly, lethal, if you're doing it wrong. So you really want to be careful if you're doing the injections. The oral is probably a little bit safer, but again, you want to make sure you're getting what you're getting. When you're doing it and you're mixing it with your backwater, if the shit turns cloudy, it's not good. And that definitely does depend. There are some peptides out there that do turn cloudy, but the BPC 157 specific should be clear. Let me show you. So this is my little bottle that I have here in a little plastic bag. It was in my fridge, but I like that extra plastic protection because I just don't want any of the nasties in my fridge to get into it. But if you look, you can see that it has already been mixed with my backwater. See how clear that is? It's clear. It's perfectly clear. That means it's good shit. If it's cloudy, you have a problem. And I just have this tiny little thing right here. That's my backwater, my bacterial static water. You can see it. It's like clear. That's it. I mean, you can get a bigger one, but for what I use it for and the amount that I use it, I just have a little one. Okay, so typically we say, you cycle on, cycle off when it comes to certain peptides, how you use them. Some of them you might use them 1 or 2 times a year, and that's it, that's all. This particular one has a half-life or it stays in the body active for 6 hours. So for me, to keep it active in my body for that whole regenerative desire, I'm taking it twice a day. So I'm gonna do it in the morning, and then I'm gonna do it again in the evening, so that I kind of keep it going and doing its thing. When you take a break, that's 6 hours. If you put it in the morning or you put it at night, good for 6 hours, then you take a break. That kind of counts as cycling, according to some of the experts in the industry. So there's that approach. Not that I would say to take it more than, say, maybe 30 days at a time. Again, it's very specific as to the condition that you're using it for. Are you using it for gastric issues? Or are you using it for, muscle tissue regenerative? So we can go into dosages. If you'd like to book a session, we can chat about that, how to dose it, which modality is best for you. You don't have to do injections. If you're looking for something to help with a gastric distress issue, then oral is just fine. You're gonna get what you need from it that way. You don't need to do intramuscular, you don't need to do injections. I'm using the injections because I'm doing reparative work. It's amazing. I will be back on my feet by tomorrow. I'm going to be in tip-top shape. So I'm looking forward to having a happy, awesome weekend and Christmas rather than being laid up on my couch like I was last night. If you have questions, leave them below. You can shoot me a DM if you're on Insta. You can find me on Instagram. You can follow me on Facebook. You can slide into my DM on Facebook or Instagram. If it's too much on the medical side, I'm not going to answer questions. You're going to have to book a consultation or a session. That is what we do here at Holly Warner Health. We have an entire medical team of awesome people, from MDs, nurse practitioners, functional medicine practitioners like myself, and so much more. All right, we'll see you later, and hopefully I'm in even less pain on my next video.